Today we will be going over the probe, more specifically the University of North Carolina or UNC probe. This is an essential part of any comprehensive periodontal assessment. It helps us determine bleeding, recession of gingival margin, amount of attached gingiva, probing depths, clinical attachment levels, sometimes even distance between teeth, overjet, overbite. Probes can also tell us the size of any intraoral lesions, mobility of teeth, and can overall help us with any measurements needed in the mouth. There are some contraindications when it comes to using the UNC12 probe. For one, we never probe adolescents 14 years or younger. We never probe patients with braces or any other orthodontic treatment. Patients with newly erupted teeth are also not to be probed. Anybody who's just completed an SRP or has any abnormal periapical pathology that we need to worry about, they're also not to be probed. Now I will be showing correct instrumentation, working order, and how to correctly read the UNC probe. Now we will be talking about the correct grasp and reading of the probe. Same as always, modified C-shaped grasp, ring finger for fulcruming, middle finger on the terminal shank, pointer and thumb to help with rolling and angulation. When it comes to reading the probe, once we pass that first line, it's a 2. Past that second line, it's a 3, 4, and then we get to the thick line, which is a 5. Once we pass that next line, it's a 6, 7, 8, 9, 10, 11, 12. So the thick lines indicate 10 readings and 5 readings. We are now going to be talking about instrumentation using the probe. Once again, we use a modified pen grasp, a very light grasp as we don't want to injure the patient. When it comes to the angulation of the probe is always angled towards the apex of the root. It is always tilted away from the tooth so it can be angled deep into the sulcus. When probing interproximally, we must tilt the probe 15 degrees into the cull space to get the deepest reading. We always use a walking stroke, not a sliding, a walking stroke so we get accurate measurements. The working order of the probe is 1 to 16 buccal, 16 to 1 lingual. We drop down to 32, we do 32 to 17 buccal, and 17 to 32 lingual. Each tooth is split up into 6 different parts. We have the distal buccal, mesial buccal. We switch over to the lingual side. We have the mesiolingual, lingual, and distal lingual. We walk it across each of those sides and get the deepest reading for each of those sides. Now we are going to be demonstrating probing in quadrant 1. So as previously stated, the working order is 1 to 16 buccal, but we work from the distal line angle to the distal and then work our way. So distal line angle, distal, 3, 3, 4. 4, 4, 3. 5, 4, 4. 4, 4, 3. 4, 4, 3. 3, 4,
4, 4, 4, 4. Now on to the lingual. 3, 3, 3. 4, 4, 3. 4, 3, 4. 4, 4, 3. 4, 4, 4. 5, 5, 5. 4, 4, 5. 5, 5, 4.